Hi, my name is Biftu Mengesha. I'm a family planning fellow at the University of California in San Francisco, and this is how I teach post-abortion hemorrhage. I find that in debriefing after urgent or emergent patient scenarios like a post-abortion hemorrhage, learners frequently relay that they either felt overwhelmed or forgot things that they know very well just because of the stress of the scenario. And I like to use these debriefing opportunities not only to provide reassurance to the learner that this happens to all of us, but also to provide feedback and potential changes for next time. I like to encourage the use of mental pathways or flow charts when thinking about urgent or emergent patient scenarios like a post-abortion hemorrhage, because I think it really encourages the learner to approach common but scary situations in a consistent and reliable manner. And that's something that'll help them not forget important or crucial parts of the patient evaluation and management while they're going through these types of situations. And by doing this, I hope that they can achieve mastery in handling these types of situations as well, a little more efficiently, and it significantly reduces their anxiety when they approach these situations when they enter in a room. And will also provide them with a lifelong skill that is so applicable to many other situations. So after managing a post-abortion hemorrhage with a learner, I like to carve out about 5 to 10 minutes to debrief after the case and provide a safe and comfortable learning environment for the student. And I like to ask them in a non-judgmental way what their thought process was throughout the case, just to kind of understand where they were coming from and what their sort of natural tendencies are for management to help tailor their learning and the pathway to that. I also like to remind learners that post-abortion hemorrhage has a lot of similarities to postpartum hemorrhage, which by the time they do their family planning rotation, they're very well versed in managing postpartum hemorrhage. And then I talk them through what I would do in terms of the pathway that I make for myself when I'm confronted with these types of situations, and talk through my thoughts and steps at each nodes of the pathway. I then encourage them to think and make up their own pathway and what makes the most sense to them in terms of management, and to run through it in their head a few times before they're faced with this type of situation again, so that they've practiced it and it's a well-oiled machine. And then I run through an interactive exercise with them with usually about 1 to 2 hypothetical hemorrhage cases. I usually focus on at-knee or placental site bleeding, and have them run through their version of the pathway with me in a non-stressful situation outside of the room. And then next time that I go through this type of experience with this same learner, I incorporate an active component to their learning by having them talk me through all of their thoughts that are going through their head at each of their steps of their assessment and management, and what their next steps are going to be. And I think that this really helps guide and help them to solidify their skills in applying a pathway to helping with these types of situations.